Mesothelioma is a type of cancer that develops from the thin layer of tissue that covers many of the integral organs known as mesothelium. The most common of the area that is the lining of the lungs and the chest wall. Less commonly, the lining of the abdomen, and rarely the sacs around the heart or sacs around the testes may be affected. Signs and symptoms of the mesothelioma may include shortness of breath due to fluid around the lung, and a swallow abdomen, chest wall pain, cough, feeling tired, and weight loss. These symptoms typically come on slowly. More than 80% of mesothelioma cases are caused by exposure to asbestos. The greater the exposure, the greater the risk. As of 2013, about 125 million people worldwide have been exposed to asbestos at work. High rates of disease occur in people who mine asbestos, produce products from asbestos, work with asbestos products, live with asbestos workers, or work in buildings containing asbestos. Asbestos exposure and on the onset of cancer are generally separated by about 40 years. Washing the clothing of someone who works with asbestos also increases the risk. Other risk factors include genetics and infection with the simian virus. The diagnosis may be suspected based on chest X-ray and CT scan findings and is confirmed by either examining fluid produced by the cancer or by tissue biopsy of cancer. Prevention centers around reducing exposure to asbestos. Treatment often includes surgery, radiation therapy, and chemotherapy. A procedure known as fluidolysis, which involves using substances such as talcs to scare together the pleura, may be used to invent more fluid from the building up around the lungs. Chemotherapy includes the medications cisplatin or semextrate. The percentage of the people that survive 5 years following diagnosis is an average 8% in the United States. In 2015, about 60,800 people had mesothelioma and 32,000 died from the disease. Rates of the mesothelioma in very different areas of the world. Rates are higher in Australia, the United Kingdom, and lower in Japan. It occurs about 3,000 people per year in the United States. It occurs more often in males than females. Rates of disease have increased since the 90s, 80s, 50s. Diagnosis typically occurs after the age of 65, and most deaths occur around 70 years. The disease was rare before the commercial use of asbestos. Other names: malignant mesothelioma, CT scan showing a left-sided mesothelioma with an enlarged mediastinal lymph node, specialty oncology. Symptoms: shortness of breath, swollen abdomen, chest wall pain, cough, feeling tired and weak, weight loss. Complications: fluid around the lung. Causes 4 years after exposure. Risk factors: genetics, infection with simian virus, symptoms or signs of mesothelioma may not appear until 20 to 50 years or more after exposure to asbestos. Shortness of breath, cough, and pain in the chest due to an accumulation of fluid in the pleural space. Pleural effusion are often symptoms of pleural mesothelioma. Mesothelioma that affects the pleura can cause the signs and symptoms: chest wall pain, pleural effusion or fluid surrounding the lung, shortness of breath, which may be due to collapsed lung, abdomen. The most symptoms of peritoneal mesothelioma are abdominal swelling and pain due to ascites, a building of fluid in the abdominal cavity. Other features may include weight loss, fever, poor vomiting, like this, heart. Pericardial mesothelioma is not well characterized, but observed cases have included cardiac symptoms, especially constrictive pericarditis, heart failure, pulmonary embolism, and cardiac tamponade. They have also included non-specific symptoms, including substernal chest pain, orthopnea, shortness of breath when lying flat, and cough. These symptoms are caused by the tumor encasing or infiltrating the heart. End stage. In severe cases of disease, the following signs and symptoms may be present: blood clots in the veins, which may cause asbestos, occupational asbestos in building. Many building material used in both public and domestic premises prior to banning of asbestos may contain asbestos. Those performing renovation work, genetic disposition. In a recent research with American population, other systemic immune system diagnosis, imaging